Evening, guys. We're going to talk about methylphenidate in depth today. Welcome to episode 175. Alright, so methylphenidate, which is Ritalin, Concerta, as well as Prefrontal, works by changing how certain brain circuits handle key neurotransmitters, mainly dopamine and norepinephrine. Here is the anatomical breakdown in a clear step-by-step way. First, your brain regions that are involved are prefrontal cortex, the most important target. It's responsible for attention, decision-making, impulse control, and working memory. In conditions like ADHD, this area tends to have underactive dopamine or norepinephrine signaling. Methylphenidate strengthens signaling here, improving the focus and self-control. Next up, we have basal ganglia, especially the striatum. It involves motivation, reward, and movement. Dopamine activity here affects drive and task initiation. The drug increases dopamine level, which can improve motivation and reduce the task paralysis, or I would say putting things back, again and again. Anterior cingulate cortex plays a role in error detection, attention, and emotion regulation. So with ADHD, it's not that we don't know the answer. We read things sometimes a little too fast, missing little points in the question or in the assignment that is supposed to be, described. So the anterior cingulate cortex enhances neurotransmitter signaling here and helps with sustained attention and reduce distractibility. So what it does at the synapse level, neurons communicate via neurotransmitters releasing into a synapse. Normally dopamine are released. They bind to the receptor briefly and they're taken back into the neuron by the transporters. Methylphenidate's main action is that it blocks the reuptake transporters, such as the dopamine transporter DAT or norepinephrine transporter NET. This leads to higher concentration as well as longer lasting signaling. Number 3, functional result in brain circuits. By boosting dopamine and norepinephrine, signal to noise ratio improves. Neural firing becomes more efficient, as well as top-down control increases for better regulation of impulses and attention. So, how does this help ADHD specifically? Well, in ADHD, the prefrontal cortex is less able to regulate attention and behavior, as well as executive functioning. Dopamine signaling is often too low or inconsistent. Just like Parkinson's, we have dopamine deficiency, and that is something that we need medication because our body just does not produce enough to like normal people. So the methylphenidate brings neurotransmitter levels into a more optimal range, restores more normal circuit function. Lastly, the important nonsense. Although it's classified as a stimulant, in people with ADHD, it often has a calming and focusing effect, not a speeding up feeling. And that is what its misconception is. Even with pharmacists that doesn't really know ADHD or how it affects, they think all the stimulants is going to make people going crazy. Oh my God. No, it actually calms me down. It makes me be able to focus and be driven and be motivated. It is not optimal to have your motivation based on medication. But right now, in my situation that I'm going through, that is something that is extremely important for me, is to keep that motivation level up. And the methylphenidate helps a lot. And that is a confession that I have to make. It doesn't mean that I'm addicted to it. It just means that I need it when I need it. And my doctor knows that as well. So make sure you always talk to your doctor. And in the next few episodes, I will go over more in depth about the mechanisms of how other medications for ADHD works. Thank you. Have a great night.